New deaths. Well, we can now add headaches to the list of after effects of a COVID-19 infection. Joining us live to talk about this is Dr. Valerie Klatz. She's a neurologist at Hartford Healthcare at their Headache Center in Fairfield County. Doctor, welcome.
Thank you for having me.
So tell me, what do we know about patients recovering from COVID and developing headaches?
So we know that headaches can occur anytime during the COVID infection. Actually, people are having headache as one of the first symptoms. It's been described as one of the top 5 symptoms people can have early on during their COVID infection. And people can continue to experience headaches long after their acute illness is over.
All right, doctor, how are you treating these headaches during COVID? Can you?
Yes, you can, definitely. Well, we first try to make sure that there is nothing more dangerous that is causing these headaches, and some of these patients will require imaging and a thorough evaluation to make sure there's nothing else going on. And as long as there's nothing structural, we really try to focus on the patient's symptoms, whether they're migraine type or tension type symptoms, which is what we're actually seeing more of. And we continue to use the medications we know that have been safe and effective for primary headache disorders to treat this other type of secondary headache disorder.
All right, tell us about what the data is telling you so far about patients recovering from COVID and developing headaches.
The data is very young, and neurologists and headache neurologists all over the world are coming together to gather evidence and anecdotal stories about how people are faring. We know that there are mild to severe neurologic manifestations. Headache is just one of the things that can happen, more likely to happen than the other more severe neurologic problems people can experience due to COVID. But we are seeing a very small subset of people have a new daily persistent headache, and these people are presenting to medical care because these are very disturbing symptoms and very painful and difficult to function.
Oh, they can wreck your life, I know. All right, and doctor, is it younger people or older people having headaches, or is it across the board you're seeing some?
So we're seeing more young women affected, and these are not necessarily the same patients who have pre-existing headache disorders. Only a small subset of people with prolonged headache after COVID infection, around 30% or less, the studies really vary, have a pre-existing diagnosis of migraine. And a lot of these people can have no headache history whatsoever prior to this.
All right, Dr. Valerie Klatz, thank you so much for joining us. We appreciate your time.